Welcome back to another episode of Intentional Wealth with Tiffany Tippins. In today's episode, Peace by Design, the intersection of health, wealth, and legacy. I'm honored to sit down with my friend, Dr. Shannon Hudgens, a woman whose insight into healing, balance, and purpose reminds us that peace is both an art and a practice. So if you've ever battled a chronic illness, or care for someone who has, you know that peace can feel like a moving target. The weight of managing health, family, and finances can be overwhelming. But what if peace wasn't something you had to chase? What if it could be designed intentionally through thoughtful planning that protects your wealth, supports your health, and preserves your legacy? That's exactly what we'll explore today. Let's dive in. Welcome back to Intentional Wealth with Tiffany Tippins, the podcast where your money is aligned with purpose and your wealth is built with strategy, legacy, and intention. I'm your host, Tiffany Tippins. Welcome to Intentional Wealth with Tiffany Tippins. We have a special guest today. Our guest is none other than the Dr. Shannon Hudgens. So Shannon is not only a very close friend of mine, she's my classmate from the great Hampton University, but she is also a double board certified physician in the state of Texas. And this is my go-to, you all, when I have concerns about my health or someone in my family is going through something. I call my friend Dr. Shannon Hudgins. So thank you so much for joining me today. I was so glad I was able to come down to Houston, Texas today from Dallas and have this important conversation. Welcome to the show, Dr. Shannon.
Thank you, and welcome to my home. And yes, we have been friends for many years.
Over 30 years, I know.
Decades
at least.
now. So I've
Yes.
known you since you were almost fresh out the womb. We've been through
Yes.
a lot together, and
We
you've
have.
also counseled me a lot on financial support and how important that is.
Absolutely.
So I'm really blessed to have our friendship throughout the years, decades. But we still look good.
We do. I have turned 50 this year. Shannon is on her way.
Next year.
Hey.
Yes.
So listen, my mother always tells me the day that you are always above ground, it's a good day.
Yes. Amen.
So, Dr. Shannon, I know how important healthcare is.
Yes.
And even when we are serious and intentional about our wealth, we cannot have anything if our health is not in good order. So, first of all, before we get into the conversation, I definitely do not want to miss the opportunity to talk about your double board certifications. So talk to me about where you started out of med school and where you are now.
Yes, so double boarded means I continue to maintain my board certification as an obstetrician and gynecologist, and I did that for a total of 10 years, including my training and then post-train work. And for a variety of reasons, life changed, got older. I shifted after doing OB for 10 years, and now I'm a palliative care physician in a hospital. So I also have that certification, and I am an active palliative care physician.
Awesome. So can we talk about more into palliative care? What does that involve?
Absolutely. Palliative care may be unfamiliar to most people, and that's understandable because we're a relatively new concept in medicine. But palliative care in terms of philosophy has existed since the beginning of time. So basically the purpose of palliative care is we help patients and their families talk through their medical care when they have a chronic but not necessarily terminal condition. And we help a lot with bringing the patient into the conversation, sorting out what treatments they want, what treatments they don't want, making sure they know the pros and cons, also making sure that we understand that medicine is a holistic concept.
Absolutely.
In addition to holistic, not just for the individual patient, but a lot of times when your health care changes or your medical condition changes drastically, it affects your family too.
It does.
And so that's where we step in and help patients and their families sort out their medical care. We also help with a lot of symptom management. That's what palliating means.
Okay.
Improving a patient's quality of life when they deal with a chronic but not necessarily terminal condition.
Awesome. So it sounds like, just in summary of what you're talking about, if they're dealing with a chronic condition, understanding that what it means for the patient, but also involving the family as well,
Yes.
and then managing that care until they become at the end stages of life.
Yes. So we can act as a bridge as you're dealing with certain medical conditions can be managed for decades now.
Absolutely.
Medicine is amazing and it's constantly evolving, which means things also can be a little bit more complicated. And so that's where palliative care comes along to additional support as you're dealing with, I call them my cowboys and cowgirls, who are dealing with whatever chronic condition that may be, your heart, that'll be your cardiologist, or if it's a cancer, that'll be your oncologist. Those are my cowboys and cowgirls who are really treating the primary disease, but palliative care comes along to say, hey, how is this patient's life? How are you living? Are you so, I'm just giving an example, are you so short of breath or so in pain to where you can't work? Maybe you want to work part-time. That's where palliative care comes in. While your big doctors are managing the big condition, palliative care comes in to help improve that patient's quality of life and maybe get you back to get those symptoms under control, or talk about how life has changed, or the new normal. That's a lot of what happens too. Maybe we have to adjust to the goals for your care and for your life, and that's where palliative care comes in and helps with that.
So I love what you said. It was a couple things that I really want to expand up on. One, that healthcare is changing.
Yes.
And it used to be that if you had a heart condition, sometimes that could be a death sentence, or if you had cancer, that could be a death sentence. But because the improvement of medicine, people are living longer. And the fact that people are living longer, then that means that we need to plan for longer living, being taken care of, whether you are in a facility or at home. Like you said, changing of whatever this new normal is. You possibly going from full-time work to part-time work, managing your disability stages, and then also going into the end of life stages and bringing the family of what that looks like.
Yes.
So a lot of times I have clients will come to me, especially when it comes to retirement, and they're healthy now, they have no issues, may have issues, which is why they're retiring. Yes. Because they're going through that phase of, I can no longer work full time. I really think about, that's where you come in and really help manage not only the patient, but what the next steps look like for that patient. Talk to me about the planning of when it comes to helping patients pivot to that new normal.
So to clarify, I'm a palliative care physician in a hospital.
Right.
I only see patients in a hospital. Palliative care can be given in an office setting, depending on what resources are available in your city or your area. And palliative care can be given at home as well. And palliative care is usually a team effort. So in the hospital, when we have patients who come in and we're talking about their medical care, and let's say the patient comes in, they're normal just like you and I, and they've had a stroke. Right? And today everything's normal, tomorrow for the rest of their life it's going to look totally different in an instant. So we help that patient and their family navigate what's next, that long-term care. And that's where we pull in our social workers and case managers. This is a team effort, as well as the other doctors and nurses and physical therapists. And a lot of what is next will depend on what your medical needs are. It's also important to know what your insurance covers. We pull in our case managers into the conversation because they can look into your insurance, see what benefits that you have, and then can come up with a short-term plan for once you leave the hospital. But then a lot of times patients will need long-term plans beyond that immediate post-hospital stay. So I say all this to encourage people to plan ahead before you get into the hospital, before you have, hopefully you don't have that, but before you have that change or that new normal event that happens. There's several ways that you can go about this, and it's important to do that for yourself. We're still young.
Yes, we are.
But let's be honest, things can change
at the drop of a dime
moment for anybody at any age. But as we get older, definitely things change. And so you can start with yourself. We always encourage patients to complete what's called an advanced directive.
Correct.
What is that? So basically, what an advanced directive is what it says. If something happens to me in the future, these are the directions of how I want to be treated. Probably the most important document that you can fill out is what's called a medical power of attorney. Who is that person to make medical decisions for you when you can't speak for yourself? Obviously, we talk to our patients directly because we want to know what they're thinking, what they're feeling. It's their body, it's their future, it's what they're living for. But sometimes conditions happen where you can't talk for yourself. And so it's important to designate at least one person, if not two or three, to speak for you when you can't speak for yourself. What's important about that is that you have a conversation, even if it's just brief. Depending on if you're young, you don't have medical problems, you may not have as extensive of a discussion as somebody who's older and on dialysis or has a defibrillator. That might be a different conversation. But it's important for that person to know what your thoughts are if you get into a situation where your condition is not curable or you definitely have a new normal moving forward. Because I have had patients fill out a medical power of attorney. That's the person to make decisions for you. I'm in Texas, and that person might be in New York, and we call New York, and they're saying, wait, I never even knew that I was designated to be this person's spokesperson, let alone do I know what their wishes are. From my standpoint, you're never too young to have that conversation because you never know. Accidents happen, right? You hope you don't have to have these conversations until much later in life, but it's still important. Is life to you living on a machine? What is life to you? That's the question. And a lot of time people have a lot of misperceptions about palliative care and what we do. The number one question I usually ask is, what are you hoping for?
I love that.
Knowing your medical condition, knowing your life and your family members, friends, church members, what brings you joy. What are you hoping for in all this? The overwhelming majority of time, people do give an answer. Sometimes it's just to be able to walk again or breathe better, or my grandchildren grow to be a little older. The people who usually don't have any hope, they may want to be evaluated for depression. So when someone starts to say that, then I get concerned that, have underlying clinical depression. A lot of times you want to have hope of what you want your life to be like. Are you trying to make it to that wedding of your child? Are you trying to make it to the first birthday of your grandchild? Are you trying to make it to Paris, your dream a trip to Paris? Those are the kinds of conversations that we have, and try to combine that with what's going on medically to come up with the best plan for the patient.
I'm so glad you said that, because I cannot tell you how many times my mother, who is a mortician and owns a funeral home, how she's gotten calls from the hospital with families just in disbelief that they just went to the hospital for what they thought was a procedure or a quick visit. They had short symptoms. They were not existing for a long time. And the outcome was death. or the outcome was non-responsive. And that has been at the age of 35, that has been at the age of 50, that has been at the age of 70. So there is not a number that death, is off limits. And I think a lot of times, shocking because you mentioned the medical power of attorney, mentioned the advance directive.
Yes.
And that patient might not have that on file.
Yes.
And for the family to have to make those decisions, should I take my loved one off of life support? It's such a burden when that could have been made earlier. And I really feel like that's where you come in with, professionals like myself, where I talk about that in my book, Plan For It. And it's conversations that we don't like to have, right?
Yes.
It's a hard conversation.
But we're adults and it gets harder as we get older and become older and things become more complicated. But we have to have these conversations because unfortunately, as you know, and I know, it's coming.
Exactly. We just,
and
you know what? I've seen the outcomes of that conversations being had, and when it's time, those people had the answers.
Yes.
And even though those answers are not what they would have liked, they knew that they fulfilled their family members' wishes because they planned for it.
Yes. Yes.
Ones that wasn't sure or they didn't know, I feel like those individuals sometimes carry the weight longer because they're on the borderline of, want this, or did she not? Did I make the right decision? Yeah. And it only comes with, I would say, experience and the relationship that they have with that person. But those advanced directives, walk through the process. And this is a simple form that you can complete at your doctor's office, correct?
Yes. So we discussed the medical power of attorney. That is one form. One thing I would like to add too, I've only practiced palliative care in the state of Texas. So each state could be different. Their forms may be different. You may have to go to a different website to download those. In Texas, the Department of Health will have those forms, or you can get them at your doctor's offices. Sometimes when patients are doing their will, sometimes the lawyers can fill out some parts of it. Some parts require a doctor's signature. But keep in mind that those documents be different in different states. I just discussed was medical power of attorney. What you're discussing is a little more broad. That's called a directive to your family and physicians. So what is that? That is a separate form from the medical power of attorney that says if I get into an irreversible or incurable condition, this is how I would want to be treated. First of all, medically, there's no right or wrong. It's all about you, your life, your body, what you believe is living at that point. Some people will decide if I get into where I'm severely debilitated and I'm not going to get better and I'm on artificial life support, if I'm not going to get better, that's not living to me. I wouldn't want to live artificially. Some people say, nope. As long as my heart is beating and I can blink my eye, medical intervention.
I'm that person. Listen, let the doctors do all they can do.
And that's what we'll do.
Say as many prayers you can. But after a certain time, if I'm not responding, don't keep me on life support for 3 years. Yeah. Even probably past, a month, because I understand that would be my wish. And even if I could come back, if God is going to perform a miracle, he will perform a miracle.
Yes, absolutely.
Right. And I believe that.
And we won't stand, in medicine, we don't stand.
Right.
We don't stand in God's way, period.
Right. But for me, and this is the difference between having a choice.
Yes.
If my mother is coming to the hospital every day, month after month, I don't want to be that burden to her. Because the other thing is, if I came out of it, and then she's having to deal with me, as you stated, what is life to me?
Yes.
It is probably not what I would want it to be for myself or for those who love me.
Yes.
And so I love that you stated that, and I think it brings a clear illustration of why it's so important to complete your advanced medical directive.
Yes.
And start your estate planning. Have you ever stopped to ask yourself, where did I really learn about money? Was it through experience, observation, or consequence? In my new book, Plan For It, The Blueprint to Building Wealth and Achieving Your Dreams, I walk you through a 3-step framework that reshapes how you think about money and building wealth. First, it transforms your perspective, taking you back to uncover the money beliefs you've carried since childhood and revealing which ones are serving you and which ones are holding you back. Second, it teaches you how to not just understand your money story, but also uncover new opportunities to repurpose what you have and grow your wealth in places you may not have even considered. And third, it tests you, challenging you to think bigger. What will your legacy be? How will you build wealth with intention, even in retirement? See, Plan For It isn't just a book. It's your roadmap to transferring your financial story and creating the life you deserve. So grab a copy today and start writing the next chapter of your wealth journey with strategy, legacy, and intention in mind.
Yes, the directive to physician, you could fill yours out and put it in writing. I would encourage you to have that conversation with your medical power of attorney, or if you don't have a medical power of attorney, who is the legal surrogate decision maker for your state. Have that conversation with them, have that conversation with your doctor. You might want to have that conversation with all of your doctors. If there's a cardiologist involved, nephrologist, or whoever, whatever consultants are involved, they can always weigh in, at least from their perspective. But it's important that we talk through it. The paperwork just puts everything in writing, and it may be good for your family members or medical power of attorney to have that paperwork, because they're already going to be a mess, right? You're already going to be an emotional mess because you're a loving human being, right? And so we don't want to see our loved ones hurting. We don't want any of them to go, but that's beyond our control. So you might be in that moment where you're so emotional, where your thoughts are not correct. And it's nice to have that paperwork, not only for you to guide, for your family as a guide on what you want. It's also the medical team who can look at things and say, okay, this is in general how she feels about things when we're getting to a point where her body's not responding like it should. And then we can have an action plan. Whatever you decide, and I know we're discussing end of life, there's going to be changes, obviously. If you decide you wanted to continue life support long term, consider who's going to care for you long term. Where are you going to receive that care? What does your insurance cover? Who in your family is able to take care of you?
Great points, yes.
Are they still working and dealing with kids, or, young kids that they're still raising, and a spouse, and, things like that? These are all things you have to consider as you're making these decisions. Obviously, if the decision is life support is not living to me, I wouldn't want that prolonged if I'm not getting better, then obviously we can shift our focus that you have a peaceful transition. But things have to be planned out for that outcome as well, Do you have a will? Do you what assets do you have? Having all that planned out and seeing how it lifts a burden just a little bit on grieving family members and friends. And I've seen where people did not, or they refused to do any kind of estate planning, and it's an added level of stress on the family members who are left to grieve for you.
Well, I believe that when people have direction, they're more clear about the next steps. And especially when you can't speak for yourself, but you've taken the time to kind of write a love letter to your loved one and say, this is what I want, and this is what I want you to do.
And there is evidence that families who are prepared and have had these discussions, as difficult and uncomfortable as they are, there is some evidence that families do feel a bit more at peace. There's no way to take away grief.
Yeah.
That's just no way. But there is a lot less guilt, a lot less trauma when you know what your loved one wanted and you carried out their wishes.
Sure. So I also think that those instructions give more clarity, not only to certain members of the family, but to the entire family.
Yes.
I think when there's a lack of instruction, that's when confusion comes. Wouldn't you say so?
Yes, absolutely. And everybody has different ways of viewing things. Even spouses don't agree.
Sure.
Even even your parents might view things differently than you do. And there's a whole host of reasons for that. But when families have a guide of which way their loved one would want to be treated, whether that's through good quality, difficult conversations, or whether that's through writing things down and combining that with what the medical team recommends, it's definitely less of a burden to those who have to make those decisions when things are planned out or discussed.
What has been some success stories? And obviously you don't have to share any names. We know that HIPAA is an issue.
Yes.
But overall, what has been some success stories that you have seen while in palliative care, where maybe death wasn't immediate, however, your patients followed the different guidelines, did the directive, followed the plan, and lived their life until they transition?
Yes, and that's a good question, because the definition of success within palliative care might mean several different things.
Okay.
In palliative care, it's a success when we listen to the patient, when the patient has a voice, and we're able to carry out their wishes. And that often happens when patients, again, have these conversations early and understand their disease process, understand what their quality of life is going to be throughout the disease process. What is the eventual outcome of your disease process over time? And over time might mean decades. Because certain conditions we can manage now for decades. And for me, there are successes. I think of the patients who said to us in the medical team, we're saying, what we see based on your lab work, based on imaging, based on what we're seeing clinically, your condition might not last for long. This might be a life-limiting condition. What are the things that are important to you? How do you want to be treated? Let's be prepared. And a patient might say, hey, I want to fight this. I want to fight as long as I can. As long as my body responds, we can fight this. And the medical team will say, okay, we'll fight with you. And as you know, only God knows. We don't have dominion over anybody's life or how long they live. And there are patients who they continue to fight until Nothing works medically, and we as a team we can tell the patient or the family we've given it our all, and they may not, their fight might not last long. Or there's patients who have defeated the odds.
Right.
And there are patients in my hospital I've been seeing for years.
Oh,
We've
wow.
developed a relationship because they've been admitted several times throughout the years. I've gotten to know them, their family, their children, where they're from. And so that can be a success in palliative care. It can also be a success in palliative care. There have been patients where they've called me in and said, hey, let's get the goals and let's make sure, is this patient ready for things like hospice? And I might do an evaluation, and based on my evaluation of their prognosis, say, hey, this is not a hospice situation. I think this patient can get better. Let me sit down and talk to them. Or the patient saying, I don't want anything done. And sometimes you have to sit down and say, hey, what's going on? If you don't want, let's say, dialysis, what are your concerns? And listening to that patient, they might say, I'm afraid because my father was on dialysis and he seemed to be suffering from it and eventually died from it. So I say, let's stop. Let's talk about that. What are your specific concerns? How long ago? Medicine, if that was 20 years ago, the problems your father had might be different. Let's pull your kidney doctor back into the conversation and help you sort out, what your fears are, what your concerns are, how, if you do have, let's say, pain related to dialysis, how can the nephrologist manage that pain? And then sometimes patients will say, okay, let me just do it 2-3 times.
The teamwork.
And 2 or 3 years later, they're like, oh, I'm fine.
Right.
So we have those successes. And then we have the success of a patient who maybe has, I'm just giving an example, have a cancer. They're in so much pain. It's almost beyond pain. They're suffering. And we're doing everything we can. And unfortunately, we can't manage their pain, or they're suffering, or they're so short of breath from their lung disease. They can't get up and walk, and they're suffering. And a family obviously loves them, doesn't want them to go, but they're not either seeing the suffering or hearing the suffering. And as a medical team, their disease is so progressed that we can't, cure it or make their condition better. And that patient may say, I'm suffering. If you prolong my life any further, this is cruel to me.
Wow.
And allowing that patient to also have a voice. And then we say, okay, we hear you. Time is limited. Who do you need to talk to? Who do you need to say goodbye to? Maybe you want to write a card out to your children. We do a lot of memory making, encouraging patients to do a lot of memory making, even if they have young children. And so that can be a success. And allowing that patient to finally have relief of their suffering and allowing them a peaceful transition through hospice care. That can also be a palliative care success. So again,
it varies.
It depends. Success. What do you mean by success? And in palliative care, it's about listening to the patient.
And it goes back to the choice.
Yes.
Of the patient.
Yes.
And what they would prefer to do about their body.
Yes, their body and their life. Medicine is amazing, continually evolving. And I've been a doctor almost, I don't want to say how long. But I was, let's not say it. Let's say it's been a while.
Long enough.
And I see the continual advances. It's a beautiful thing, but it can also cause nuances, right? We can keep you alive longer. Our interventions can keep you alive longer, but are you living? Have we improved your quality of life? And again, that's where things get more and more complicated, and that's when we have to go back to the patient,
right?
And understand their definition of life and living.
What gives you joy within working within this industry? I know it's so many things that, some things you can control, and then there's a lot of things that you can't control.
Absolutely.
But what gives you joy within the work you do?
What brings me joy is the people.
Okay.
The patients, their families, them allowing me to be a part of one of the most difficult times in their lives. Also, we have a lot of diversity in my hospital. The county I live in, it's 25, 25, 25. So 25% white, 25% black, 25% Hispanic, 25% Asian. And I love learning how different cultures grieve and deal with death, and even language and culture, and how the body is, handled as the body's transitioning, and just learning a lot about life. I talk to people all day long about their lives. Who's important to you? What have you, tell me about yourself. That's one of the first questions I usually, before I get to the medical things, tell me about yourself. And as patients, their lives are changing, or maybe they're at the end of their lives, you learn,
what's really important.
Yeah. And who's important to them. So that's what brings me joy. And then also the people I work with. Just the doctors, other doctors, nurses, respiratory therapists, social workers, chaplains, and just how it's really a team effort, and just constantly being amazed at how the team works and things that people think of, and the innovative ways, and people bringing in their own experiences. So I think that, to answer your question, I will go back to the people I work for, which are my patients and their families, and the people I work with.
Oh, excellent. I love that answer. What would you like to see? We talked about the advanced directives and medical power of attorney, a little bit get into estate planning. What do you think you'd like to see more of families do when it comes to that, of preparing? Because I think, these conversations are difficult. The next episode we're going to have is legacy conversations over an individual in Houston who created these cards called When What If Happens.
Good, yes.
Because it's not if it's going to happen, it's when it's going to happen. And so from a physician and your standpoint, what would you like to see more done or implemented within the conversations of planning?
What I would like to see more is, number one, making sure patients and their families have realistic understanding of their medical care, of their disease process. What is the typical prognosis once you get diagnosed? What is the progression of that disease process? One of the major ones we deal with is dementia. Dementia almost has a predictable way of, when you get from the early stage to the moderate stage, these are the signs and symptoms. When you get to the severe stage, this is what happens. When you get to, and this is beyond our conversation. That's a whole nother
no worries, but I love it.
But, and what does the end look like when we know where we're getting to the end? And I would love to see more people, not just with dementia, but other chronic diseases, start from the beginning of understanding what's the disease process. Start these conversations when you initially get diagnosed, or at least start thinking to yourself, what, 10 years down the line or 15 years down the line, when I do get towards the end or get to the severe stage, how do I want to be treated? What mechanisms are in place? Who's going to care for me? What does my insurance cover? Do I have enough support in the family to have caretaker support? Am I going to have to hire somebody? Those are the kinds of things. You don't have to have all the answers in one conversation. They happen over time, over years, decades. But I would like to see just more health understanding, and that comes from us, meaning the medical team, the healthcare team, just making sure our patients understand their disease process. Yeah.
Well, I would love to invite you back to Legacy Conversations.
I love that.
Yes. When What If happens, because I love it not only from a healthcare point of view, a financial point of view, a legal point of view, and an estate planning point of view.
Yes.
And bringing that together really starts the conversation and really starts the education process, what you just discussed of, hey, this is where we are, and this is where we can have more education about the process of the disease and how we need to insert more conversations about planning around that path.
Yes, absolutely. And one of the questions that was brought up at a work event is, we have these emergency toolkits for, we're living in Texas, for hurricanes or floods or a storm, and we have, we have all of our evacuation plans and everything that we need. The question is, what's in your emotional toolbox for the life storms that come?
Wow. Now that is a question.
That is a question.
That I'm even pondering on that right now for myself. I think that's powerful. Like, what is in your emotional toolkit? How do you position yourself emotionally to even prepare for the event?
Yes.
And I believe that is a thing, but that's also being open to counseling.
Yes.
Really at the start of the process, therapy, because I think a lot of people shy away from that as well, and they feel like, oh, I'm going to take it to Jesus, which you should.
Yes.
But
Jesus is our Savior.
He is. Or I'm just going to pray about it. But we wrestle.
Yes.
We wrestle with that, and that can interrupt our sleep, us worrying constantly, which most of the time the caregivers are taking that stress on themselves.
Oh, yes.
So I like that. What's in your emotional toolkit?
Yeah. And that it's a difficult question, and even I'm still sorting through that. And then we could also have another discussion about caretakers. That's a whole nother. We're noticing now that a lot of times the caretakers are family members, or you're dealing with the elderly person. Maybe they're 90 years old and their caretaker is their spouse who's 91. And sometimes what we're noticing is that the caretakers are getting sicker than the person they're caring for. So that's a whole. We got to talk
again, girl. Okay. Well, thank you so much, Dr. Shannon Hudgens, for coming on, because not only is your wealth intentional, your health is definitely important and something we need to be intentional about. Thank you so much.
Yes, you're welcome,
awesome.
Friend.
What a powerful conversation with Dr. Shannon Hudgens. Her story reminds us that peace isn't just found in perfect circumstances. It's something we create through intention, preparation, and faith. Whether you're managing your own health challenges or caring for someone you love, remember this: planning is not just about money. It's about preserving your peace, your dignity, and your legacy. If today's episode spoke to you, share with someone who needs encouragement to keep going and keep planning. I'm Tiffany Tippins, and this is Intentional Wealth, where we align purpose, prosperity, and peace. Until next time, take care of your health, protect your wealth, and keep building your legacy by design.